So you're big on IV sedation.
Yeah.
I mean, you love it, you said.
Randy, I do love it because my patients love it.
Okay.
And, fear is one of the biggest things that, honestly, like fear is one of the biggest things that I have to help people overcome to get, quality dental work. And through IV sedation, it really allows people to get a lot of different kinds of treatment without having to experience any fear whatsoever.
So what are if you had to categorize, what are the different dental conditions where you use IV sedation the most?
Yeah, so there's 3 basic reasons to use sedation. Okay. The number 1 reason is just fear. Like fear is a spectrum. Like I don't like going to the dentist. You probably don't like it either.
Yeah, I don't love it.
I know you like using nitrous when you come to the office.
I do, I love it.
But, some people are scared of going to the dentist, but some people have this pathologic fear, like it's a medical problem.
Like a phobia.
Yeah, like a
Really?
phobia, exactly, that's a great word. That they can't go to the dentist. And so with IV sedation, that takes all that fear and phobia like out of the equation for people. So I have people that just need routine dentistry, like cleanings and fillings and crowns, that really can't go to the dentist otherwise. So that's the number one.
Nice.
That's one of the types of people that I use IV sedation with. The second is you may be in need of like an obnoxious procedure. Like I say this jokingly to patients, you would never have your appendix taken out awake, right?
Yeah.
Everybody goes to sleep for having that type of procedure. There are procedures in dentistry that we do that nobody does awake, like have your wisdom teeth out. Some of the implant procedures that we do require IV sedation.
Okay.
So that's the second category of people that we use IV sedation for. And then thirdly, we use IV sedation for people who are just undergoing lengthy procedures. So say, for instance, you haven't gone to the dentist in 5 years and you need a mouthful of dental work. There's no way you can sit through 4 hours worth of dentistry because you want to be healthy again at one time. So we use IV sedation because what it does is shortens that appointment. It takes that 4-hour appointment where you're getting all your dental work done at one time into an experience that seems like minutes or seconds to you. So oftentimes, it's really funny, I have patients wake up and say, are we starting yet? Are you ready to start? And we've just done 4 hours worth of dentistry.
Is that right?
Yeah, so it's a really unique way to receive care. And it's a great way to help, because if you're anxious in my chair, it's really hard for me technically to deliver high quality care. So if we can lower that anxiety level, for whatever reason, you need it, then I can do high quality dental care in your office. And it's important to understand also, Randy, that not all dentists do this. It's something that I went to extra formal training. So I did a residency program after dental school where
At a hospital, you said?
At a hospital, yep. I was at a hospital that I did this training. So we trained with oral surgeons and anesthesiologists on how to do IV sedation. And so that I have a special permit in California that qualifies or allows me to do, based on that training, to do IV sedation for patients.